You should start thinking about hospice for your loved ones when you notice a significant decline towards the end of their life. Truly, the majority of hospice cases I witness, it's usually in the final weeks and days of life. And that's because of a huge misconception about what hospice is. Hospice is not just mom or dad only has a couple days to live. Let's sign them on to hospice and sit at the bedside. Hospice is for a patient who has 6 months or less to live. It's an estimation. You don't know. But if you have a loved one who you see potentially may have 6 months or less to live, then they're a good candidate for hospice. It doesn't mean you're giving up. It really doesn't. It means that you're saying, let's have this company who has a whole team of loving, caring professionals come out and be an extra support system. And even greater than that, it's having the philosophy of this. Let's recognize that we all have a time that we're going to pass on. Let's not live in denial for the final 6 months of our loved one's life. Let's actually recognize that we are on limited time in this life. And so let's make the most of that time. Let's make mom or dad comfortable. Let's stop sending them back and forth from the hospital. Let's stop poking and prodding and doing every test in the book to try to reverse the tide of something that's coming regardless. And that's what I try to tell my family members and people that I work with. I say, look, I want you to do everything possible for your loved one. I'm not telling you to give up on them. That is not what's going on here. But what is going on is that everyone's going to come to that point where they're going to pass on. And far better to recognize that and look at it as objectively as possible and enjoy that time rather than stressing and struggling and fighting something that you cannot control. And hospice is going to be your best friend in that situation. They have a chaplain, they have nurses, they have case managers, they have medical directors like myself who are going to come out and really be there, support. They're going to give education. They're going to help with medications. They're going to adjust pain medications if someone's uncomfortable. They're going to promote the best quality of life for those final months and weeks and days.